welcome to another session from Green World Group. Today's topic is about first aid, CPR, and AED. This is again a very short preview of what we will be presenting you with a full-fledged training, if you choose to believe, if you choose to take from us. Now, about CPR, about first aid, even after me providing this course to you, you do not become a medical professional. Okay? Me providing this course does not make me a medical professional. I don't become a doctor. But what is the point of this course then? Well, first aid is a basic necessity to every human being, I believe. And everyone should have the knowledge to provide basic first aid. For what purpose? To keep a person alive just for two things to occur. Either you get to the hospital or the ambulance comes to you, either or, right? So we need to take these steps as quickly as possible and as competently as possible to keep that person alive and not create as many problems or not create secondary problems. We will explain this in much more detail, but let's go into this course as quickly as we can. So, what is a first aid? Well, it's the first help that you would provide to aid someone in case of sickness, injury, or close to fatality, so you could say, right? So there are essentials to this that we will discuss in much more detail, but let me get to the major three purposes of providing first aid. First purpose is to preserve life, to keep that person alive as long enough to, again, two things to happen. Either you get that person to the hospital or the ambulance comes to you. Second purpose of the first aid is to prevent secondary complications, meaning you stay at the problem at hand and do not create another one, do not create another one, do not create another one. One of the most simplest way I can explain this to you is that the first thing you see when you open the first aid kit should be, or first thing you should use, is the medical gloves. The medical gloves saves both of us, the victim as well as you, applying the first aid. Well, we never have the time to stop what we're doing and then, or we never have the time in case of an emergency to tell the individual that, okay, hold on a second, I have to go wash my hands and come real quickly. Come back real quick. It's not possible, but we shouldn't waste our time doing that. So the first thing we do is put on the gloves because our hands might have a lot of bacteria or germs or diseases, bacteria that can infect the individual's wound. But not only that, we must protect ourselves from bloodborne pathogens that can be transmitted from the victim, the bleeding victim. So it goes both ways. Again, we stay at the problem at hand and we don't create more complications along the way. Then comes the third purpose of the first aid kit, is to promote speedy recovery. Again, our human body is beautiful, but as soon as we get hurt, if we take care of it, if we apply, if we sanitize it, if we cover it up, if we bandage it, we start the healing process because our human body will regenerate as quickly as it's as we apply first aid properly, right? So here are the three major purposes: preserve life, prevent secondary complications, and third, promote speedy recovery, right? So universally, usually people would hesitate helping others because of legal reasons. People would say that, oh, if I couldn't save this person, then while helping him, he passes away, then I will be legally obliged to be sued. But there is a Good Samaritan law that is universally practiced, which is generally that if you were doing it for good intention, if you were trying to help an individual or you were trying to assist in the saving that person's life, according to the Good Samaritan law, you will be pardoned, right? Despite you save that individual or that person is not able to be saved. But our mental consciousness would always be that what if we tried, right? So for those reasons, we must always try helping people as much as we can, right? For good Samaritan reasons. Now, universal do's and universal don'ts. I want to talk about just the don'ts here because right now during the pandemic, everyone is wearing masks. But the universal don'ts, first of all, we must never prescribe anyone medicine because we're not doctors. Unless you are a doctor and you can prescribe someone medicine, that's a different story. But not prescribing anyone medicine because we don't know. Maybe this medicine might have side effects to any individual because of their pre-existing conditions, right? Again, a doctor studies an individual, takes a case, and then he prescribes medicine that is suitable to that individual. But not only that, do not ever put prescribed medicine in a first aid kit. It shouldn't be belonging in there. Why? Because a first aid kit is general, it's for everyone. There should be no edible medicine in there except one, which is aspirin. And why aspirin is there? Well, for that, please make sure you take our full classes for a first aid provided by Green World. And the second thing that you should never do is declare death. What happens with that is, let me give you a scenario. If someone's heart stopped beating and he's collapsed on the floor, and you run up to him and you stand there and say, oh, he's no more. Now, if anyone else competent enough is going to come towards this incident, and if you say he's no more, that person gives up before he even tries, right? So we don't have the right to declare death. Even when paramedics would arrive or doctors arrive, they would never just plain out say, oh, he's no more. They would try. While they load him into the ambulance, they'll be providing him CPR and constantly trying to revive him. Even when they get to the hospital, they will do as many things as possible to keep this person from dying. But after trying everything, and if they do fail, then they will declare that person to be dead. But we don't have the right to say that. Our job is just to try as much as we can, because sometimes it will take 20 to 30 cycles of CPR to revive someone. Sometimes it will take maybe 1, 2, or maybe 5. But we should not give up. We should keep trying, right? So what should be our action plan? Our action plan consists of 5 major things. Very first thing is call for help, call for backup. You must call for backup, understand the situation, what it is, so that it's easy for you to communicate that to the emergency units on the call. But you must call for backup, because you could be there all day and nobody will come, nobody would know, right? So very first thing. And this is one of the major steps. Even if you are bedazzled and you are shell-shocked of the magnitude of the incident that is happening there in front of you, and you feel helpless, well, the first thing you should do, or sometimes in most cases, the only thing you could do is call for help. So you must call for backup. Then calmly take charge. Because if you are not calm, then you spread panic, right? Again, panic is something that we are trying to eliminate as much as possible. So calmly take charge, right? Then check the scene and casualties. There could be many other casualties. There could be still a hazardous situation developing. It could be a hazardous atmosphere. It could be more things that are happening. But you must check the scene. Is it even safe for you to go in? Maybe spread people out, get people away from the scene of the incident, and look for casualties. Who else is hurt? How many people you would need to provide first aid for, or to take care of, right? And then carefully apply first aid. Now, the reason why we're saying carefully apply first aid is because first aid kit, so to say. It's a box, right? All the essentials are in there. Now, if we act very harshly, or we hurry, or we start running, which would also be very panicky, what we do is that we might accidentally release the contents all over the place, right? So now it's in a box so that it stays safe, clean, and sanitized. But once we harshly open it, or everything, all the contents spread across the floor or wherever, it could be easily contaminated, right? So now it's no good to anybody, right? And then the last final thing is communicate the status and write a report. Well, this is two parts. First, communicate the status. To whom? Where? Well, if you have done the very first thing, which is call for help, well, by the time you get to this fifth action, you'll see results, meaning the ambulance might be arriving at this point. So, and if they catch you doing CPR, it's not like they're going to stop, or if you hear the sirens coming and you think, okay, everything's fine, I should stop. No, you should keep continuing because we should keep trying. But when they will arrive, they will see you doing CPR. If you're doing it adequately, they will start setting up their AED and then ask you in that process, what happened, how it happened, and you need to deliver all that information very clearly and very descriptively of whatever you've seen, whatever you've accumulated from that incident, so that they can then decide how to proceed and what they should be doing, and check off things that you've already done, so that they get a clearer picture, right? Then comes the writer report. Now, when everything is said and done, and they've loaded the person into the ambulance and they're taking him to the hospital, whatnot, well, then either your organization or the local police will pull you to the side and ask you for a report. Now, it's done right there and then. Why? Because of the authenticity, the clarity of it. Because whatever you would say there, you wouldn't have time to think, but instead you'll be saying everything truthfully, and you remember everything also. So they want to capture as accurate of information as possible, so that they can write all of that down, or you can write all of that down and turn in the report. So eyewitness report, to say what happened, how it happened, what did you do, and how did it proceed, right? So it clears you, and it also gives them a better case study to prevent that from happening ever again, or file that case, so to say. Well, so these were your 5 action plans. Now, what is the skills that a first aider should possess? Well, he should be a good observer. Obviously, he's seen something happen. That caught his eye, or an incident that happened. So he's observed that this has happened. Then he should talk to the individual, because it's very important to get consent to talk to an individual who is a victim, who's just fallen onto the floor, maybe to figure out what the signs, what the symptoms are, and look for signs and symptoms in that speech pattern. But most importantly, get the consent and give that comfort to that individual of who you are, what you can do, and how you were going to help them, right? Then comes the touch. You must touch the individual to see if there's a heartbeat, to see what those injuries are. Obviously, if you see him bleeding, then you know that there's an external bleeding occurring, right? But the touch part really comes towards the heartbeat. Then feel the heartbeat if you can, but also feel the breath. Feel the breath on the outside of your fingers by putting it underneath his nostrils, right? But listen, and you can also apply your ear directly to this person's chest to see to hear if this person has a heartbeat, or even the faintest, right? And that's one of the best ways to figure out if the person is beating, if its heart's beating. Because to be honest, in a situation, in a very serious situation, obviously you yourself, your heart yourself will be beating much faster than it usually would because of the magnitude of the incident, and the responsibility that you will have to save this individual's life. The listening really helps when you can apply your ear directly to the person's chest. to hear the heartbeat with eliminating all other misunderstandings or complications, right? And then provide. So once you've assessed the situation, you can now determine either you need to provide this person with CPR, or you need to provide this person with first aid measures, right? But most importantly, throughout this whole process, a first aider must build trust. And it starts from the very beginning, from the talking part, that he must introduce himself. He must get the consent if that individual, if the victim is conscious. But he must build trust throughout the whole process. Now, a simple way to explain this is if someone, let's say, is bleeding out and he's on the floor, and you stand above him and say, "Oh, I don't think you're going to make it." Well, that's not really helpful. Even if he was going to make it, now that you really disheartened him. But building trust throughout the way by providing this person with verbal comfort and keeping this person away from closing his eyes, or so to say, staying away from the light. But you must provide this person with that sense of comfort that who you are, what you can do. You have notified the ambulance; they are on their way. Just hang in there. These are great words. These are very comforting words, and helping this individual out through this time. Because when a person is on that floor, his life is literally flashing by him. Every past deed he's done, or every unfinished thing that he's is yet to finish in his life, everything that's pending in his life is going to be flashing by him, his loved ones, and so on. And you would have to give him that motivation or distraction, so to say, to give him that support. Now, let's get into CPR. There are a lot of phrases out there that describe CPR, but I'm going to go with just the ABC or the CAB here, which is three major things when we were talking about CPR: compressions, airway, and breath. Now, for compressions, we've come a long way to what we used to do and what we are doing now. We had different hand formations. We had this, or you may, some people would go in for the punches. But what we've now come to is the simple hand formation of applying our fingers in this format. The reason why this is so helpful is because if you notice your palm, well, there's a high point, there's a very deep point, and then there's a higher point. So in order to even the surface out, we use the other fingers that apply in this format to create a flatter surface. It's flat enough, right, to apply the proper amount of compression and apply the proper amount of pressure required to jumpstart that heart. Then comes the airway. The airway needs to be open before we provide that mouth-to-mouth breath. Now, in our throats or in our necks, there are two major ways. One, we eat food, it goes into our, through that valve, it goes into our stomach. Then we're constantly breathing, so there's another valve that goes into our lungs, right? Now, if the only way we can open our airway is by tilting our head backwards, right? What that allows to happen is that it closes the stomach valve, and it opens up the air valve, which allows the oxygen that you are providing to him going into the right place, into our lungs, not into our stomach. Because if it goes into our stomach, we can have secondary complications such as if unprocessed food can come right back into the throat, or could create more problems such as choking into the victim. Then comes the breath. We should be providing an individual with 2 breaths. This is very important. Why? Because we are jump-starting the heart by compressions, forcefully applying that, but we're also applying fresh oxygen forcefully into the lungs, which is very important. Right? Again, more practical aspect of this, feel free to join one of our sessions, led by me, of course. But we would be able to provide you with more details thanks to Green World Group. Now, explaining in more details of how the hand formation should be in terms of opening the airways. As you can see, those two valves right there, one from the mouth and one from the nostrils. Right? You must apply gently the two fingers to the chin bone, right, and onto the forehead of the individual, and try leaning it backwards. The reason why we're saying the chin bone because it's much more solid, and if you go anything lower, then you could be pushing the tongue in an uncomfortable position. All right. So there are different ways to check breathing. We can either put our ears, we can feel the breath sometimes onto our faces. We can feel it on our hands. We can place a hand onto the chest to feel a heartbeat. But one of the best ways to feel a heartbeat is by putting the ear right to the source, which is the heart, the chest. Now, CPR. I've been saying CPR all this time. What is CPR? CPR is cardiopulmonary resuscitation. Right? It is one of the quickest ways that any individual can provide to a person whose heart has stopped to keep that person from passing away. Right? Now, it's very important that we must provide this as quickly as possible because before the blood dries up, lack of movement, lack of circulation of oxygen as well as blood in the air. All right. So, yeah. So when should we provide CPR? Well, we should provide CPR whenever we have identified that the individual, the victim, does not have any vitals. But we should never provide CPR to an individual that has vitals. So if the person's heart is beating, then CPR is not your way to go. It will create more problems. Even while we are training, we will use dummies to show exactly how CPR is done, but we will never use an actual volunteer. Why? Because it will create more problems. Obviously, we can stop a heart by applying constant pressure to the heart itself. It'll skip a couple of beats. So in more detail, we will also be providing how to do CPR to infants as well as to toddlers. And not only that, but also babies and children from the ages of, I think, to the ages till 10 to 15, 10 to 11. So when do we stop CPR? When do we stop providing CPR? How do we know? Well, we should stop applying CPR when help arrives, not when you start hearing the sirens, but when the paramedics come and they set up their AEDs and their support, and they start asking you questions, and they'll take over from you. So that's stopping CPR for you, but not for them. They will keep continuing. When you're exhausted, that doesn't mean you should give up, but if you have people available, you could be, and if you know that that you would need help, which you should always. So you can train people on the spot, saying that, hey, watch me very carefully, or you can split the load with that individual, saying that, okay, I will do the compressions and you can do the breaths, or we can switch back and forth to keep this going. Then third, when life appears. Of course, you don't need CPR anymore if you've jump-started the heart, you've resuscitated a person back to life. You would then be required to put this person into a recovery position, right? Which I will also talk about. And then lastly is when it's pronounced dead. Obviously, we don't have the right to pronounce anyone dead, but if the paramedics have pronounced someone dead, or the doctors pronounce someone dead, then we must respect that call, because they didn't just say it. They've tried everything, and after trying everything, was it successful? And that's when they will declare that individual. But we often, because maybe it could be someone or one of our loved ones, that we would be entitled to keep trying. So we must not provide CPR to an individual who's just gone unconscious and he is breathing, and there's a heartbeat. So if a person is not breathing and he is unconscious, then yes, we would be providing someone with CPR. But once we have revived that individual, we must place him into a recovery position. Exactly how that is done, we can be explaining that in future sessions. Just to give you an exact look of what the recovery position is. Yeah. Right. Now, the AED, the automated external defibrillator, this is one of the best piece of tech that mankind has ever created to save people's lives, my personal opinion. But this is a very smart piece of tech. First of all, it's automated, meaning it speaks to you. It tells you what to do. Okay. Then comes the external part, the defibrillator part, sorry. It will, first of all, there are pads that are for different body types. So if it's a child, the pad will have an image of where to place it. So it's very self-explanatory. Then, or onto an individual, place those pads exactly where the image says, because these pads have a sensor that connects to the device itself and analyzes the body. It analyzes the body in terms of understanding how big it is, how much charge it should emit to resuscitate this person, right? So, and it will speak to you through the whole process, telling you what should you do and how you should be doing it. So even after providing the AED, and once it's charged fully and it emits that shock, it is very important that we are not in contact with this. This piece of tech is so smart that it will identify that if we are touching or if we are in contact with the individual, the victim, it will pick up our heartbeat and say that there's life. So we should not have any contact with, well, if we're providing CPR and we've applied the pads, we should stop CPR, let the machine, let the AED analyze the body and charge up accordingly. And once it's ready, it will tell you to press the button to emit the charge. And we remind you not to have any contact with the individual for that period. But once it's done and that person is still not alive, it will also tell you to continue with CPR and how many cycles you must provide. Oh, a CPR consists of 30 compressions and 2 breaths. That is 1 cycle of CPR, by the way. So with that, and if, again, this device is quite smart, and once there is a heartbeat, even the faintest of heartbeats, this machine will tell you to stop, and it will tell you that there is life. And then you can place that person into a recovery position. So what is in the first aid kit? Well, you have a whole lot of things. 3 major tools that you have is scissors, tweezers, right? And what was the third one? Yeah, so we have scissors, we have tweezers, right? And then, sorry, 2, mistaken. So we have alcohol swabs in there. We have different types of bandages for different purposes. Then the only edible medicine that we can keep in the first aid kit is the aspirin. And aspirin is only there for heart attack patients. So individuals who would be going through a heart attack, we should be providing that person with an aspirin. But it's not just take an aspirin with water. No, it has to be taken without water. And the victim must bite it, chew at it, and then swallow it. So it's not just an immediate swallow, but he must break it up and swallow it. What an aspirin does is that it's a blood thinner. And a heart attack occurs due to a blockage, due to cholesterol forming next to or inside in a major artery, which could disperse. Sorry, it won't disperse, but what happens is that once you take the aspirin, it thins the blood so that the blood will find its own little smallest of gaps, and it will keep the circulation going. Again, this is a very temporary solution to just keep this person alive till either two things happen: you get to the hospital or the ambulance comes to you. All right. So again, when you take this course with us, it will be much more detailed, of course. We will be talking about major things in more detail about heart attack patients, strokes, heat strokes, exhaustion. Not only that, we'll talk about cuts, internal bleeding, spinal cord injuries, certain sicknesses, even contagious diseases. And we'll talk about a lot more, and plus nosebleeds as well, and so on. So these are very essential things that I believe each and every individual must have knowledge of, and so that they can take care of themselves as well as the loved ones around them. But not only just limited to that, but everyone around them. So with that, thank you very much. I'm Fasih A Ahmed, and this is Green World Group. Thank you very much. Take care.